So root canals, it's one of those names that can make people feel uncomfortable. It's a dental procedure that has a reputation that doesn't actually match the reality. The truth is, a root canal isn't as scary or as painful as people think or people make it out to be. In fact, they're a pretty straightforward way to save the tooth and get rid of pain or infection or damage. And today, I'm going to be explaining everything that happens during a root canal, step by step, in a simple way that actually makes sense. And by the end of this video, you'll have a clear understanding on why this is a really good, pain-free way to try and save a tooth from an infection. So why do root canals have such a bad reputation? So root canals didn't get the reputation out of nowhere. Years ago, things were very different. So the tools, the techniques that dentists used back then weren't as advanced as they are today. So the numbing agents or the numbing methods weren't as effective as well. So back then, for example, patients sometimes felt pain or discomfort throughout the procedure, which ends up making people feel nervous. But here's the truth. Dentistry has come a long way since. So modern techniques or modern anesthetics have made the procedure to be much more comfortable, much more pain-free towards the patient. So today we have better tools that are much more efficient and precise. And we also have anesthetics that are far more effective than what they used to be at keeping you comfortable. So why do people still think that root canals have such a bad reputation? A lot of it really comes down to misunderstanding. And that's because people don't know what's going on throughout the procedure, which can naturally make us feel nervous. And also make us imagine the worst. So the name alone can sound intimidating because it doesn't really give off that this will be fine type of vibe. Another reason is people tend to remember or tend to talk about negative experiences compared to positive experiences or experiences that have gone smoothly without any issues. So this ends up creating a snowball effect, making root canals sound much worse than they actually are. So the reality is a root canal is designed to stop the infection or the pain and not actually cause it. And the discomfort people associate with root canals is often pain that they were already feeling from before the procedure. And it's usually the infection or the damage that was made prior to the procedure, which ended up causing the procedure to be necessary. And once the root canal is done, it's meant to save the tooth and make the tooth pain-free. And I just wanted to clear up those old fears and misconceptions because root canals are nothing like what you may have heard it to be, because they're one of the most effective ways to relieve pain and save your tooth. And also the process is much more simpler and comfortable than you might think it is. To understand why you need a root canal in the first place, first you need to understand the structure of a tooth. So I made a quick sketch over here. As we can see, the enamel, which is labeled in blue. So the enamel is the tough outer layer of the tooth. And then we've got the second layer, or the sensitive middle layer, which is called the dentin. And that is labeled in green. And then we've got the pulp, which is labeled in red. And that's the center of the tooth, which contains the blood vessels and the nerves of the tooth. So what can cause the pulp to be infected or damaged? One reason could be decay. Or an untreated cavity or a deep cavity. Sometimes that cavity can go through the enamel and then through the dentin, and it can reach the pulp, which can irritate the pulp and cause the infection or the abscess. The other reason potentially is a crack. So sometimes a crack can infiltrate bacteria and can also cause the pulp to be damaged. And one other reason sometimes is trauma. So a hard hit on a tooth, even though there might be no visible damage, that can also cause the pulp or the nerve to die. So essentially with a root canal, what we're trying to do is we're trying to remove the pulp, which is the center part of the tooth. So we clean that bit and then we can seal it and fill it. And that way we can prevent or try and prevent any future infections from taking place. What are some signs that could mean that you need a root canal? So not every toothache means that you need a root canal, but there are some signs that we sometimes look out for. So things like persistent pain. So if a toothache that doesn't go away or keeps coming back, that could mean that the pulp or the nerve is infected. Sometimes also sensitivity to cold or hot. So if a tooth reacts strongly to hot coffee or something cold or like a cold water, and the sensation lingers and stays for a long time, that could be another potential sign. One other sign as well could be swelling or tenderness. So that could mean that there's an infection and that's spreading to the surrounding soft tissue. Another sign could be discoloration. So if a tooth turns gray or black, that means that the pulp or the nerve has died. And another sign is pimples on the gums. So sometimes that could be a sign of an abscess and that needs immediate attention. If you notice any of these signs or symptoms, don't ignore them, because the earlier you see a dentist, the easier it is to treat the problem before it gets worse. So what happens during a root canal? Now, when it comes to root canal, there's a lot of fear and misconceptions out there. And the truth is, a root canal is one of the most effective ways to try and save the tooth and to also stop pain or infection from spreading. And while it's not everyone's favorite thing to hear, it's definitely not the horror story that it's made out to be. So let's break it down step by step. Now, it's important to keep in mind that every case is different, but this is just a general overview of what you might expect during a root canal and why each step matters. So the first thing we do is numb up the area. So the first step is making sure the area is completely numb. Local anesthetics are used to try and block any pain to make sure you're comfortable throughout the procedure. And for those nervous about needles, modern techniques have made this step far easier and less intimidating. So once the anesthetic kicks in, you'll feel pressure at most, but you shouldn't feel any pain. And if you do feel any pain throughout the procedure, it's important to speak up because adjustments can always be made. The second step is isolating the tooth. So the rubber dam basically helps prevent any bacteria from the saliva or from your mouth to enter the tooth during the procedure, and it also helps ensure no tools or materials fall into your mouth. And it's an extra step, or it's a precautionary measure to make sure the procedure is efficient. And while it might feel different at first, many people barely notice it after a few minutes. So the third thing we do is create an opening. Now, once the tooth is isolated and numb, the next step is to create a small opening within the tooth. Now, what this does is it gives us access to the pulp chamber, which is the center of the nerve and blood vessels. So the goal here is precision. So the opening is made, and we're trying to minimize as much damage to the surrounding structure as possible. And we're also ensuring that as much of the natural tooth structure is preserved as well. The fourth thing is removing the infected pulp. So inside your tooth, the pulp becomes infected or inflamed, and that could be due to several reasons, which we discussed earlier, which could be the deep decay, could be the cracks, or it could even potentially be the trauma. And the infected pulp is what causes the problems, or the infection, or the abscess, or the swelling, or whatever the reason led you up to needing a root canal may be. Over here, we use specialized tools and materials to remove the pulp carefully. So we use something known as files. Now, for molars or back teeth, they have multiple canals, which means that this step could sometimes take a bit longer, but that's because each canal has to be treated individually. And removing the pulp is like clearing out the source of infection, because that way we're trying to ensure that the source of infection doesn't spread. The fifth thing we do is cleaning and shaping the canals. So after the pulp is removed, the canals are cleaned and disinfected to eliminate any lingering bacteria or debris from staying behind. And once that's cleaned, the canals are then shaped and prepared for a filling or a root filling. And this step is crucial to sealing the tooth properly later. And sometimes a medication or a medicated dressing might be placed in the canal, especially if the infection is big. And that means that the procedure would have to be done in 2 appointments or 2 separate visits for the medication to work. And then later on, we fill the canals. So now the empty canals, which are sort of hollow inside, are filled with a material known as gutta percha. So gutta percha is a rubber-like material or substance that seals the canals completely. And that basically helps prevent bacteria from re-entering the tooth, and also helps stabilize the internal structure of the tooth. So think of it like replacing the pulp with a stable protective barrier or material to help keep the tooth functional and also infection-free. So the final step here is sealing the tooth. So the opening that we did at the beginning of the procedure is then sealed, and depending on the situation, that might involve a temporary filling or a permanent restoration. And for back teeth or teeth with significant damage, sometimes a crown is often recommended. However, not every root canal requires a crown. For example, front teeth with minimal damage might do just as fine. With that being said, root canal teeth do become brittle over time, which increases the risk of cracks and fractures. This is why crowns are recommended to sort of increase the fracture resistance of a tooth, especially when there are teeth that are under heavy chewing stress. So how long does it take? For most single-rooted teeth or front teeth, generally, the procedure can be completed in 1 visit or in an hour, but again, there are variations to this. And molars, which have multiple canals, might require longer or might require a second visit, depending on the complexity, because no 2 teeth are exactly the same. But do keep in mind that each dentist has their own technique and their own approach and tools, So timelines and techniques do vary, but overall the procedure is meant to be as comfortable and as efficient as possible. Now let's talk about what happens after a root canal is done, or after the procedure is done. So is it normal to feel sore? And the answer is yes. It is normal to feel sore. You can feel some mild discomfort, sensitivity for a few days. This isn't your actual tooth that's hurting. It's the surrounding tissue that's healing. Think of it like having a bruise. And what can you do to feel better? So over-the-counter medications, sometimes ibuprofen can do the trick. Avoid chewing on that side or on that tooth until your dentist places a permanent or final restoration or filling or a crown. And also stick to soft foods for the first day or two, just to avoid irritating the area. So obviously if the pain gets worse or doesn't settle down after some time, it's important to speak to your dentist, because sometimes, even though complications are rare, it's important to have it looked at. So why would you choose a root canal over an extraction? So some people might think, why not just pull the tooth? Wouldn't that be quicker, cheaper, easier? While there are cases where extractions are necessary, saving your tooth, from my point of view, with a root canal is often a better option sometimes. So one reason could be you get to preserve your natural tooth. So your natural tooth is designed to be there. So your natural tooth is designed to function there along with the rest of your mouth. While replacements like implants or bridges are excellent options for missing teeth, keeping your natural tooth always allows you to maintain that natural feel and function of a tooth and the appearance as well. So it's ideal to save what's already been there. And the second reason is because it can avoid future complications. So when a tooth is removed, it leads to a gap, and that gap can make the adjacent teeth shift into the gap over time. And when these nearby teeth shift into that gap, it can potentially cause alignment problems, bite problems. It can also affect the chewing and speaking as well. And also that can cause the jawbone underneath to shrink gradually, and that can impact the structure of your face. So a root canal basically preserves that space and helps avoid these secondary issues. But keep in mind, there are situations sometimes where extraction is the best and the only thing to do. For example, if the tooth is too damaged to save. So there you have it. Everything you need to know about root canals. It's not as scary as people make it out to be. And in most cases, it's the best way to save your tooth and stop pain for good. If you're curious to know about how to prevent cavities, or if it's even possible to reverse them, I suggest checking out my video about reversing cavities, and also breaks down everything you need to know about how to keep your teeth healthy and strong. And thanks for watching. I'll see you in the next video.